As CAR-T come into earlier lines and are much more accessible in countries like Germany, but also France, Spain, Italy, when we have this European meeting here, European CAR-T meeting, we have to talk about access, because not everyone in Germany, even in Germany, but even in Europe, can afford or can get CAR-T cell therapy. So we have a lot of investments into academic CAR-T products, point-of-care products, decentralized manufacturing. But first of all, we need to state that there is inequality and inequity in Europe when it comes to CAR-T access and therapy. The other issue is that about affordability, because if we want to have equality, we have to have affordability. Patients need their same money to invest in the same therapy in Bulgaria, in Germany, but also in Switzerland, in Poland. So we have to discuss what the next few steps should be to implement this equality. And that's what we have to talk here and somehow find a solution.